Hello and welcome to today's SRP education event, Medicare 101. My name is Sarah Krapek and I'm the Director of Participant Experience for Strategic Retirement Partners. And we appreciate you joining us for this third session in our 2023 education series. We are especially excited about today's topic. A few quick notes before we get started today. All the lines are muted, but we do welcome your questions. If you have one, please get out your phone and fire on the QR code that you see here right in front of you. It'll also be on the presentation slides throughout the presentation. That will take you to an online form where you may submit a question. I'll monitor those kind of in the background while Nicole is speaking today, and then we'll get to as many as possible toward the end. This session is being recorded, and the recording will be sent out via a link to all who registered later this week. And with that said, I am pleased to introduce our distinguished presenter for today, Nicole Morgan. Nicole has over 20 years of experience in the healthcare field. She has expert knowledge of Medicare and navigating the healthcare system. Nicole is Medicare certified and founded her company, Morgan Medicare Solutions, in 2018. They are a resource for everything Medicare, and they offer free consultations to their clients. Nicole is passionate about helping seniors. I can vouch for that, having spoken to her several times in the past. And she helps them find the right plan in Medicare and transition into Medicare with ease, which I'm sure all of you can appreciate. So thank you, Nicole, for being with us today. And I invite you to take it from here.
All right. Thank you, Sarah. Appreciate that introduction. So we're going to get started. I'm going to be respectful, hopefully, of everybody's time. And we're going to get through Medicare in about 45 minutes. So please, again, if you have questions, make sure that you ask them. I'm sure I will spark some of those today. But just a little bit about my business here. My services are at no cost to my clients and people that I consult with, answer questions for about Medicare. I assist people in Medicare sign up all the way to plan enrollment. I am independent in my agency, and I specialize in Medicare plans. I'm licensed with multiple states and multiple carriers so that I can give a non-biased recommendation. My practice model consists of education first and foremost, and that's what all of you are doing here today, is getting the proper education that you need. I do client-centered research for enrollment and help with enrollment, and then I provide an ongoing lifetime service and resources for Medicare and also aging. So what we're going to cover today in a short amount of time is how and when to enroll in Medicare, parts of Medicare, what they cost and what they cover, costly Medicare mistakes to avoid. We do not want any Medicare mistakes because those come with penalties, and penalties come for life. And then we're going to talk about the options of Medicare, which include your supplements, your advantage plans, drug plans, and then those are your types of coverage. And then kind of some questions to go through about choosing the right plan for you. And so this is a purely educational topic and presentation. There is going to be no carriers discussed and no specific plans discussed. So this is purely educational. So if you're on this call, you're probably confused by Medicare and want to know more about it. Well, that is the majority of everybody that's eligible for Medicare. The government right now, and they're trying to do a better job, but haven't quite got there yet, is preparing people for Medicare and what to do. Most times people are scrambling of, who to call, where do I get this information? And a lot of times people get conflicting information about what to do and when. So hopefully I can simplify it for you today to at least give you a good basic foundation. The first thing we're going to tackle is enrolling in Medicare. Before we get into it, though, I want to give you some helpful hints. that I have come across along the way that helps my clients and totally makes the process smoother. Before anybody applies for Medicare, everyone needs to have a Social Security account by going to ssa.gov. And if you don't have an account, you need to get one. Anybody that's over the age of 18 can have a Social Security account. If you don't have one, what this account does is it tells you when to collect, or you can kind of guesstimate when you're going to collect Social Security and what amount of Social Security benefits you're going to get. And also, this is going to be the avenue that you will apply online for either Social Security and, most importantly, Medicare. And people don't realize that Medicare actually utilizes Social Security. They are not the same thing. They are two separate entities, but Medicare can't handle everybody signing up for Medicare, so they contract with Social Security, and you will apply online through your Social Security account. So I help and walk people through that process. Once you're on Medicare, the next account that you need to have is you need to apply with your Medicare ID number a Medicare.gov account. So we've got an account you need to have before you enroll in Medicare and one that you need to have after. I like people to have the Social Security account already set up and already learn how to navigate that account and also how to log in, because there's always that special security to log in each time you do, because it's a government website. And for some people, it actually freaks them out to even do that. So when you are first eligible, and that's talking about people that are turning 65 and they're planning to go on Medicare, Medicare gives you a time frame. It's called the initial enrollment period, and that is 7 full months to really get all of your ducks in a row to apply for Medicare and get all of your plans situated. They give you 3 months before your birth month, they give you your birth month, and then they give you 3 months after. Now, we're going to go over this. There's some information in this presentation that's going to be repetitive, but that's okay because you need to hear it multiple times. Medicare will start on the first day of your birth month if you're turning 65 and going on Medicare. For those of you that are born on the very first day of the month, like April 1st, this whole 7-month time frame gets shifted up by 1 month. So instead of starting on April 1st when you turn 65, you're actually going to start your Medicare on March the 1st. Okay. A little rule that you find out later. The easiest and the most convenient way to sign up for Medicare is to go through your Social Security account online through ssa.gov. You can call your local Social Security office. There's a national number for Social Security, and you can also find your local Social Security office around you and call them directly. You can either sign up by phone, or they may have you set an appointment to do that either in person or on the phone. They give you 7 full months to apply. I personally think that if you're planning to go on Medicare when you're 65 years old, then it's 3 months before your birth month. That's the best time to apply to get your Medicare ID and to get your plan in place so that it starts on the first day of your birth month. If you apply in the last part of that initial enrollment period, the latter 3 months, you could delay a little bit the start of your Medicare Part B. So if you want everything pretty smooth, you apply in that first 3 months so it starts on the very first day of your birth month. Like I said, it begins on the first day. The little rule is unless you're born on the 1st. So signing up and paying for Medicare. So if you are collecting Social Security, and some of you may be already collecting Social Security before you're 65. Well, if you are, then you are automatically signed up for Medicare Part A and B, and you will receive a Medicare card in the mail about 3 to 4 months prior to your 65th birth month. And then your Part B premiums, which is the part of Medicare, we'll go over that you pay for, they're going to be auto deducted from your Social Security check monthly. But if you're not collecting Social Security or you collect Social Security after you're 65 and you decide to wait, you will have to sign up for Medicare online, and you will be billed for your Part B premiums in a quarterly amount. Okay. So you'll probably get a bill if you pay the standard rate, which is $164.90 a month. You'll get a bill for $494.70. That will be in a range, typically about 3 months, but sometimes they like to tack on a month or two on there, depending on where the bill lands and when you signed up for Medicare in the Medicare billing cycle. There are other ways you can pay your premiums to Medicare. You can go through Medicare.gov. When you set up your account, you can set up as Easy Pay, which consequently takes 6 to 8 weeks to set up. And that's where the government takes that monthly premium out of your bank account monthly. Or you can actually pay with a credit card online, a health savings account, or a debit card online. One of the big questions, and most of you on this call may be planning to work past 65. This is a really big question. Do you even have to get on Medicare when you're still working? Well, you can actually choose to stay on your company plan, your company health insurance, if your employer is over 20 employees. You will not be penalized. A lot of you may hear, well, you've got to sign up, you got to do something when you're 65 or you'll get penalized. A lot of us hear different things from different circles of influence that we're around, but I can assure you, as it is written in the Medicare guidelines, that you will not be penalized, and you can actually go on Medicare Parts A and B later if you stay employed and covered by your group health insurance. And a lot of us may have dependents that we're still covering, and a lot of us may have our insurance paid for by our employer. So that's kind of a no-brainer right there. And then applying for Medicare when you retire. If you do apply for Medicare later, when you do retire over the age of 65, you're going to have to need proof of your employment. So this is going to wipe away any penalties that you would get because you're really out of your initial enrollment period. And now you've moved into a special enrollment period because you're getting Medicare later and you've been covered by your group health. So there is 2 forms that people need. One of them is that proof of employment, which is a form called CMS L-564. You can Google this form, you can download it, but your HR person has to sign off on that form, and there will be some dates that they'll have to fill in, proving basically to the government that you've been covered legitimately by your employer since you were 65. But all in all, which option is going to be better for you? Is it better for you when you're turning 65 to go on to Medicare, or is it better for you to stay on your group health? So a lot of times I'll get a person and they don't plan to retire but 2 years down the road. But when they're 65, they do a consultation just to get a good timeline in place, just to get all the do's and don'ts in place, and just so they feel secure that they are doing the right thing and that they won't get penalized. So I do think it's good to have a consultation when you're nearing 65, even if you plan to work over 65, is just so you know and have peace of mind that you know what you're doing when the time comes. I will say this, timing is everything. And Medicare is an essential part of your retirement planning. It needs to go hand in hand. A lot of times we are planning our retirement, we're giving to our 401k and that sort of thing, but we miss the boat when it comes to adding that Medicare component in there, because probably we have the least amount of education coming at us for that whole process. So that's why it needs to go hand in hand. And I tell all of my retirees that they need to plan or start the planning process for retirement and also for the Medicare process 3 months before they plan to walk out the door. Now, we know we don't live in a perfect world, and you could decide tomorrow to retire. Okay, so and that happens. And so we know, I just tell people they need to give me a call. We set a plan in place and we take some action depending on what the situation is. But 3 months is a good time to start planning, getting with a consultant, asking your questions, making sure that you have a plan. So now let's get into the real heart of everything, and that is the parts of Medicare. Here's where some of your questions may come into play. There are 4 parts of Medicare, and they have letters. They are called parts. There's A, B, C, and D. We're going to first talk about Part A. Part A is just hospital coverage. And if you've worked 40 quarters or 10 years and you've paid into those Medicare taxes, then you will qualify for premium-free Part A. And if you want to see that you are qualified, you log in, you create that Social Security account online, and you log in. And if you see all these green bars, and it probably doesn't have any bells or whistles or balloons or anything that comes down, but it does say that you're qualified for premium-free Part A if all of those bars are highlighted green. This part of Medicare covers hospitalization, skilled nursing, home health care, and hospice. It does have a first day hospital deductible of $1,600. Okay, I'm going to call that a whole of Medicare that I don't want to pay, and I don't want you to have to pay. So we can fill that and make that go away. But there are some copays you need to be aware of on Part A. The first 60 days you're in the hospital won't cost you anything, but thereafter that, all the way up to days 150, it can cost you per day. There's another hole in Medicare of the cost. We want to fill that with the right plan so that we're not out that money on Part A. Skilled nursing is also covered under Part A. The first 20 days are at no cost to you. You get up to 100 days per year, and days 21 through 100 has a copay per day, and it's gone up to $200. So these copays fluctuate each year. Medicare changes each year, and all of those changes come out towards the end of October, early November for the next year. So if you stay beyond 100 days in a skilled nursing facility, that's really long-term care, and Medicare doesn't cover that. So it's all out of your pocket. Part B is what's called the medical insurance. Now, this covers your doctor visits, medical tests, medical treatment, all of your medically necessary services, and your prevention. This is also, I call all of that outpatient services. Okay, not your hospital, but everything that's outpatient is covered under Part B. And there can consequently be drugs that are administered in the doctor's office that are also considered Part B coverage. This part of Medicare does have a premium, and this is based on your adjusted gross income from 2 years ago. So anybody that's getting on Medicare this year in 2023, when you sign up for Medicare, they're going to coordinate with the IRS. They're going to look back at your tax returns from 2 years ago, that modified adjusted gross income, and that's what they're going to set your Medicare premiums on. They will adjust it year to year going forward. Okay, every January they'll adjust it, but they're always going to look back 2 years. Okay, so I know when we retire, we get off our employer, we're not having that salary anymore, our income does level out. So if you start out high, paying a high premium in Medicare, you may not pay that, in a few years in retirement. So as it stands this year in 2023, so if you file your taxes with a spouse or significant other, they're going to set that standard rate that you'll pay. If your adjusted gross income is $194,000 or less, you'll pay the standard rate. For a single person filing their taxes by themselves, to pay the standard rate of Medicare, it has to be $97,000 or less. There is a really complete chart that is found on Medicare.gov. I have access to that. I can share that with SRP as well, but it tells you the different thresholds of income. The higher you go, the more you will pay. High earners will pay more. They will pay what's called an IRMA, an income-related monthly adjustment amount. And I always tell my client, IRMA is not nice. So for my high earners, it tends to be, I'd rather not, they look at it as a penalty. But unfortunately, you're going to have to pay more for Part B, and you're going to also have to pay an adjustment, an IRMA adjustment on your Part D premium. So the highest level it goes right now is all the way up to $560.50 a month. That's what someone could be paying per month for just Medicare Part B. And in addition, whatever drug plan they get, they can be paying an additional $76.40 a month. Medicare Part B also has an annual deductible, and the annual deductible this year in 2023 is set at $226 for the whole entire year. That is subject to change year to year. Last year it was up $4, this year it's down $4. The scary part, if you just have Medicare A and B and you have nothing else to help you or protect you, what I call the package of protection, okay? Because what are we trying to do? We're trying to not be out all of our retirement income in paying medical bills. But if you just had Part A and B, that's your hospital and your doctor visit, all of your outpatient, and nothing else, you would owe 20% co-insurance on everything that you got, all of your health care. And when you talk about really bad illnesses, let's talk about cancer. Cancer is one of those that could rack up even in the millions. So, 20% of that cost for treatments for that, nobody wants to have to pay. It's a hole that we can fill and we can make it go away. Part C is the Medicare replacement. This is probably one of the most confusing parts of Medicare, and I do consequently, when we talk about this in a consultation, I spend a lot of education on it, because this part of Medicare, you all get calls about, you probably get a lot of mail about, there's tons of TV commercials out there. They can be very, very misleading. And so it's really important to understand this option. It is a Medicare replacement, and it is called an Advantage plan. You still have to be enrolled in Medicare. So you still need Parts A and B, and you will always pay your Medicare Part B premium. These plans are county and region specific. So meaning that each plan has a service area and a number of counties that this one plan is in, or in a region. So there are plans that cover the entire state. In every state of the United States, there are regional plans. These plans are insurance plans. So they are with a specific carrier, and every state is different. Every state has different carriers. Every state has different plans. They are categorized as either HMOs or PPOs, much like probably your group health plan is right now. HMOs require referrals, PPOs do not. They are called a Medicare replacement plan because they include the benefits of Part A, Part B, and Part D, which is the drug coverage. They do include extra benefits overall. We're going to talk about those in a little bit more detail. Part D are your drug plans. Drug plans are required by Medicare. If you don't get a drug plan because you're super healthy, you don't take any drugs, and you only take supplements, and you don't get a drug plan when you are first eligible, whether it's coming off of your employer or whether it's turning 65 and going on Medicare, if you don't get a drug plan, and you get one later, you're going to get a penalty. And penalties with Medicare follow you for life. It's not like a fine. It's not like you just have to pay them forever. Even if it's $5 a month, you've got to pay it forever. There are a few ways that you can get a drug plan. You can get one that is included in an Advantage plan. You can get a standalone plan. And with every state, there are different amounts of standalone plans that are available in every state. Or if you're a veteran, you can get your drug coverage through the VA. Medicare will not penalize you for that. All of these drug plans that are all available in each state, they're all different. Premiums are different from state to state, even if it's with the same carrier. Deductibles are different. Formularies, the drugs that are covered, are all different on all available plans. Drugs are categorized into tier levels, tier 1 through 5, and the higher the tier level, you will pay more. So when I do so part of my business is really evaluating drug cost. I would probably say that this is probably one of the most, well, there's a lot of things that are confusing about Medicare, but this is one of the most. And you get really good drug coverage on tier 1s and 2s. Drugs, those are your generics and your preferred generics. But when you started getting into tier 3, 4, 5, in now even 6, your real specialty drugs for cancer, you're not going to have a lot of coverage. Some people even choose to stay on their group health because they do have better coverage than Medicare. It's really, really good to evaluate. A lot of times, drug cost alone will navigate me into the recommendation that's most appropriate just because of drug cost. Name brand drugs can be an issue on Medicare. Some of the things that they don't tell you, not all doctors accept Medicare. So it's a really good idea if your plans are to go on Medicare, whether you're retiring or turning 65, you need to ask your doctor, okay, are you going to continue to see me when I'm on Medicare? And what type of Medicare plans do you take? Do you take just original Medicare or do you take Advantage plans? And you have to be that specific. Medicare doesn't cover everything. It does not cover assisted living. It does not cover long-term care like your nursing home care. And it doesn't cover custodial care, which is a non-medical provider in the home, which all of us would know as a caregiver. The holes in Medicare cost can be very serious. So we want to make sure that we are choosing the right plan so it's not eating up our retirement and medical bills. Drug plans and Advantage plans, they can change every year. And we are about to embark on the season of change in October. And that's when everything is going to be changing for the next year. Traditional Medicare doesn't have any dental care, routine vision like for glasses or hearing aid coverage. You've got to get standalone plans for that. Here's another thing for all of you employees that are planning to work past 65, and maybe you decide to retire and your company offers you COBRA. However, you are eligible for Medicare. This is a time that you probably need to talk to a consultant. COBRA is not credible with Medicare. Because you've got Medicare available to you, they don't consider COBRA credible because mainly you're not working anymore. Okay. And even though it may be the same health insurance that you have had through your employer, Medicare doesn't consider it credible. And they only give you 8 months to be on COBRA before they'll start sticking you with a penalty. So that's really good time if you are offered COBRA to look at your situation. Who are you covering? Who can you get other plans for? And what do you need to do as the beneficiary? The other thing is, for you that are still working, if you plan, so some of my employees, they'll go on Part A of Medicare and decline Part B so they don't have to pay for it and stay on their group health, okay? But if they are contributing to a health savings account while they're working, I won't have them apply for any part of Medicare. Because if they do, and they're contributing to their health savings account, and I'm specific, health savings account, HSA. If they do contribute while they're on any part of Medicare, they could, and that's the wording on Medicare.gov, they could get a tax penalty. So a lot of times we're very strategic about when we stop that HSA, and Medicare does recommend that you stop contributing 6 months prior to you getting on Medicare or any part of Medicare. And then again, I'm going to stress timing is everything. When should you enroll? What is your timeline so that you can avoid any penalties? So let's talk about your Medicare options. So I try to give as many visuals as possible, and I have always had this in my head, and so I decided to put it as a slide. So Medicare has built this road of healthcare, and you've got two options, two different types of cars, so to speak, to choose. These are your options. You can stay with traditional Medicare, where Medicare is your primary payer. That's your Part A hospital, your Part B, your doctor visits, and then you take out a separate Part D for your drug coverage, and then a Medigap or a supplement. We're going to talk about that. That's one option. The other option that you have is the Advantage plan. And I'm going to tell you a little algebra problem. It has the benefits of A, B, and D, and that all equals in a nice little package, Part C. This is the Medicare replacement plan. It's an insurance plan with a carrier. It's an HMO or PPO. That's your other option. So really, you have all these commercials and all this mail coming to you, and you really only have two options to choose when you get on Medicare. So let's talk about the Medigap, also known as the Medicare supplement. Let's talk about that first. This works with original Medicare. And when I say original Medicare, I'm meaning Medicare Part A and B. So these are called plans. Okay, so supplements are plans. The Plan G is the most popular that you'll hear about. This Plan G has no copays and does pay the full 20%. Remember that 20% that's left over on Part B of Medicare? It pays that 20%, but you have to pay the Medicare deductible of $226. Okay, so in the other one is a Plan N. Those are the two most popular plan supplements, Medigap plans right now. But you may, on a Plan N, have a copay. You may have a $20 copay at the doctor's office, and you may have a $50 copay at the emergency room. It provides the same exact coverage as a Plan G, covering the full 20% with the small copay that you have to pay at the doctor and the emergency room. And you have to pay the deductible of $226. All plans that are sold, everything that you get in the mail, TV, everything that talk about a supplement, if it's a Plan G, every company that sells it, the government standardizes the way that they're supposed to cover you in providing coverage. So every Plan G is the exact same coverage. They're all identical in coverage except the price that they set. For each company can set their own price. They can raise their rates differently. When you're first on Medicare, that's when you get Medicare Part B. That first 6 months, you have a golden ticket window, so to speak. You can get a guaranteed issue supplement. They're not going to ask you any health questions at all. So when you first get Medicare, that first 6 months that you're on Part B, you get a supplement with no health questions asked. Guaranteed issue. These plans, adding that to your original Medicare, will allow you to see any doctor anywhere that takes original Medicare. Your Medicare is billed first, and then Medicare will send the rest, that 20% left over, to your supplement to pay the rest. Drug coverage is not included in Medigaps, so you have to get a standalone drug plan. And each state offers so many different drug plans that are available to you with your mix of drugs. Dental, routine vision, coverage for glasses and hearing aids are not included, you add standalone plans for that as well. So here's another visual. Like I said, a Plan G is a Plan G. The coverage is standardized, so all the coverage is equal, but every company that sells it can set their prices differently. Okay, so it's like comparing apples to apples as far as coverage goes. The next one we'll talk about is the Advantage Plan, the Medicare replacement. So they are private insurance plans subsidized by Medicare. So, and all in all, to try to keep your cost lower. So I'm going to give you a really short story. I'm keeping watch of time, but a short story. Medicare losing money, we heard that forever. And so they needed to find a way out, a solution, so to speak. So they looked to the insurance industry and they said, we want you to develop a plan for the senior, but we're going to kind of control behind the scenes and set the guidelines for you, but we want these to be available for anybody. And so we're going to give you money. We're going to subsidize these. We're going to give you money per month to take care of a beneficiary. Your job is to control those costs. So these plans are with an insurance carrier. They have the benefits of A, B, hospital, doctor visits, and drugs included in it. And they're supposed to manage the care based on the money that Medicare has given them. They do have to follow some rules. The first rule is they have to cover everything that Medicare originally covers. They can never ask a health question ever, and they do have to be approved by Medicare every year. Like I said, they include the benefits of A, B, and D of Medicare, and most of them have low premiums, like $0 premiums, no deductibles. Most of them include drug coverage and extra benefits. They do abide by doctor networks, much like your group health plan does already right now. HMOs or PPOs, how they manage healthcare costs is they put copays on everything, on all healthcare services, and they also put a limit on how of all the copays that you spend. So there are max out-of-pockets. Those max out-of-pockets vary with every single plan. They can be as low as $2,900 for the year, all the way up to over $11,000. So all of these plans are different. Like I said earlier, they are county or region, statewide specific, and they can only be changed during certain times of the year, special enrollment periods, which one we're coming up on October 15th through December 7th. That is called the annual enrollment period. That's for people that are on Medicare to go ahead and make a change. They get an open opportunity to change their Advantage plan to a different carrier. Or they have January 1 through March the 31st, another opportunity to change the Advantage plan. This is more like fruit basket turnover. You could have one carrier that has 14 different plans, all different service areas, all different doctor networks, and all different benefits, copays, maximum out-of-pockets. And this probably is now getting overwhelming to like, oh my word. Now we're getting into all the choices of this one option. So let's again do a quick review of the differences. And I know we're getting through this fast. So a lot of times in my consultations, we take our time and we review this very, very slowly. So this is traditional Medicare, what I call it, versus the Advantage plan. So on traditional Medicare, you have Part A and B as your primary, then you have a drug coverage with your Part D, a standalone drug plan, and then you get the Medigap. You can go to any doctor or hospital that takes Medicare. There are no networks and no referrals needed, no copays beyond the Medicare annual deductible with a Plan G supplement, and there's no maximum out-of-pocket to meet, but the premiums for these supplements can increase each year. And you do have to purchase a standalone drug plan and any other policy that you want to add to your protection. And then they don't have any dental, hearing, or vision apart with that. That includes those extra policies that you'll need to add. Then Part C equals and has included in it the benefits of A, hospital, B, doctor visits, and D, for drugs. These doctor choices are guided by the plan's network. They are HMOs or PPOs. Referrals are always needed for HMOs in most cases. They have extra benefits included. They have a Part D. On the majority of plans have a Part D drug plan included. No deductibles on most of them, and they do have low monthly premiums. And then you share in your healthcare expenses up to a maximum. And you have to meet that maximum out of pocket in order for the plan to ever pay 100%, where all the copays go away. So here are some mistakes that people that need to avoid is missing your enrollment deadlines. Plan ahead. Don't miss any enrollment deadlines. Know who to call and when. That's super important so that you don't miss any enrollment deadlines. Missing the Medigap open enrollment period. Some people don't know about that little 6-month golden ticket window. When they first get the Medicare Part B, they've got that first 6 months to get a Medigap plan with no health questions asked. That's your supplement to Medicare. And then enrolling in Part B. So remember I said all of these, you have your circle of influence, you hear a lot of things, and they say you've got to do something when you're 65. Well, if not advised correctly, some people will pay for full-blown Medicare and still pay for their employer plan where money's being taken out of their check. That could be a potential problem. You don't need 2 insurances. Failing to review your coverage yearly. It's always a good idea to touch base with a consultant or your agent every year to make sure that you're on the right plan. And assuming that Medicare is free. A lot of people get hit between the eyes. I just had a lady in Houston get hit between the eyes. She could not believe that Medicare was going to cost her anything. The Medicare is not free. You will have to pay for it. And also, if you plan to work past 65 and you want to change jobs, people don't realize that you have to keep proof of your credible coverage through that one little form we talked about, CMS L564. You have to keep proof of your coverage for every job you have over 65, because that little form will wipe away any penalties with Medicare. And then it's real important, talk to your doctor before you get on Medicare. Understand what your doctor's office takes as far as Medicare goes or Advantage plans. And some doctors, they kick you to the curb, unfortunately, when you're 65, and they won't have anything to do with Medicare. So it's a good idea to talk to them prior. So now it's probably overwhelming. Hopefully you do have some questions, or I've sparked some questions at least. But, when you're deciding on a plan, the first thing is to really understand the options, the definitions of what a Medigap is or a supplement versus the Advantage plan, and how you want to be covered. So I kind of take people through a series of questions and trying to evaluate what their needs are and what their wants are and where they feel secure in the kind of plan, because you really can't compare it to your group health anymore. Medicare is a whole nother beast. So, how important is it to you to keep your own doctors? Where do you live? Do you live in the city where there's lots of options, or do you live rural? Do you live in the country where there's fewer options? How many medications do you take? That can make a big difference. How important is it for you to have low monthly premiums and the extra benefits? And then what is your budget overall? What kind of package of protection are we building for you in retirement? And then how flexible do you want your plan? So a lot of these questions go in a consultation just so people can decide which one is best for them. So I'm going to go through a fast forward review. What day does your Medicare coverage begin? Well, it begins on the first day of your birth month, unless you were born on the first of the month, then it's going to begin the month before. How and when do you get your Medicare card? The easiest way is to sign up online through your Social Security account. If you're collecting Social Security, you will automatically be signed up for Medicare, and you'll get your card in the mail 3 to 4 months before your birth month when you turn 65. Part A, it doesn't cost you anything if you qualify, but Part B will cost you, and that is based on your income from 2 years ago. If you don't take any drugs, do you need a drug plan? Yes, you do need a drug plan, because if you don't get one when you're first eligible, you will rack up a penalty. And the penalties follow you for life. Are all supplements with the same letter exactly the same? Yes. Every company that sells a Plan G supplement out there in the United States all provide the exact same coverage. The prices are different, and that can be set in your zip code. They all set their prices differently. Do supplements include drug coverage? No, they do not. You have to get a standalone drug plan to cover your drugs. Are all Advantage plans the same? Nope. Remember, it looks like fruit basket turnover, even with one carrier. One carrier can have 14 different plans. They're all different. Who has the best drug plan? Can't ever tell you that, because it's always going to matter what your mix of drugs are. What's good for your neighbor may not be good for yourself, because you take different medications. Should you stay on your company plan after you turn 65? It all depends. What is your situation? What are you paying? Let's compare it to what you're paying now, who are you covering, and what it's going to look like if you go on to Medicare. Do a good, legitimate comparison, and that's what a consultant like me is for. Do you have to worry about pre-existing conditions? On an Advantage plan, never. On a supplement, the first 6 months, no. But there are guidelines and rules going back and forth between these two options. And I won't get into that today. That may be a question. But yeah, pre-existing can come into play depending on if you're switching back and forth between the original Medicare versus the Advantage. Should you get a primary care physician before you go on Medicare? If you don't have one right now, I would suggest that you get established with one that does take Medicare, because being a new Medicare beneficiary and having a plan in Medicare and you don't have a primary care physician, it can be hard to find one that'll take on a new Medicare patient. So questions for me that people tend to ask is, yes, I can help find the right plan for individuals. I offer plans not in every single area. I realize that we are on a call that is widespread. So I'm only licensed in 18 states, and connected to agents all over the United States as well. People mostly can enroll in a plan through me if I am in their area and provide coverage in that area. Does it save you any money to do it all yourself going online versus using an agent or consultant? No, it's going to be the same either way. Do you have to meet one-on-one? It is advised that you do meet with one-on-one, just with someone that can answer your questions, you can get a timeline, and that you can feel secure about what you're doing. You've got to have a consultant that can steer you in the right direction, and you have to feel secure, and you just have to know that they know the rules as well. And I never charge anything for my services as well. So in a consultation process, typically, phase 1 is the education, okay, on one-on-one. Phase 2, I do client-centered research specific to that client, and then enrollment in a Medicare plan. And then we schedule a no-cost consultation to find the specific plan for them and receive expert guidance. You get a personalized Medicare roadmap, guiding you each step along the way. So for me, I may take 2 or 3 visits to go through the whole entire process with someone, just so they feel secure. And then we always analyze the cost amongst each option. And then providing lifetime service is very key. You want someone that is near you or that you work with that's going to provide you with guidance throughout your Medicare journey, through the whole aging process, the whole Medicare journey completely. So if you do want a consultation with me, I offer a free consultation. This is my information. This is a QR code directly to my calendar. that you can hop on my calendar. I'll do a free consultation with you. You can go to my website. You can call my office and schedule through my office. This is my email address. You can reach out to me by email. I would love to take all of your questions and to make sure that you have all of them answered. I promise you I will have the answer. My appointments usually last 30 minutes to an hour, depending on the situation. With that said, you also can find me on Facebook, on YouTube, and you can find my complete resume on LinkedIn as well. So with that said, Sarah, that is the end of my presentation. Did pretty good with a few minutes to spare.
Nicole, you did a phenomenal job coming in right on time and giving us such a wealth of information about Medicare. However, you are correct in that you have sparked many, many questions, and I have several that have come in. So if you don't mind, we're going to try to hit a lot of these. So some of these, like you said, might be repeat, but I think it's good because if people are asking questions, it means they need a refresher, right? So one person said, my full retirement age isn't until I turn 67, and I'm assuming they're thinking for Social Security purposes. Will my Medicare age be then or still when I turn 65?
Your Medicare age is still when you're 65. So It really doesn't play into when your full retirement age is. Medicare is 65.
Okay. Another question came in, says, I'll be 65 in 3 years. What is the likelihood that all these rules are going to change before I am eligible?
Good question. I think Medicare will still be around. The numbers will change for sure. I can't guarantee that the rules will change, but the numbers for sure change. Plans change each year. You also have to take into consideration any change that's proposed in the government. I mean, it takes years to take effect. So right now you're good, but I will tell you this, about a year out from 65 or even 6 months out from 65, that's a good time for you to have a consultation to get a plan in place.
Okay. And along similar lines, Nicole, this person said, I assume that Medicare won't be there for me. So consequently, how much should I increase my retirement savings or savings in an HSA? So what would you tell the younger contingent that maybe is farther out from 3 to 5 years of retirement?
So I'm kind of in that category myself. I don't know if Medicare is going to be around when I approach 65. I have no idea. I'm going to take it year by year. So I really cannot fully answer that question. That's something that you definitely need to look to your financial advisor about. More and more people think that they can live off of Social Security. And I don't even know if Social Security is going to be around when I approach 65. So that's where you're going to put all of your trust in what you're saving for retirement, for sure. Work with your financial advisor. People cannot live on Social Security alone anymore.
That's right. And being on the retirement plan and wealth management side of things at SRP, we would just say that's all the more reason to provide for yourself through your savings efforts throughout your career, and we can help determine what the optimal amount is for you. Several people asked if they would get a copy of the presentation, and what I would say is a recording of this presentation is going to be sent out probably within the next 48 hours to all who registered, so you will have an opportunity to view a replay. We are not going to be sharing out the slides specifically, though. More questions coming in. What caveats or special considerations apply to military retirees or government employees?
So they have a little set of different options. You've got, your VA benefits. You've got TRICARE for Life. TRICARE for Life is one of those key things. Typically, those people are really set. You've got to have Medicare anyway, but there are Advantage plans that are geared towards veterans that don't have drug coverage because they expect you to have drug coverage at the VA. So as far as military goes, there are different options, but it's what your situation is. TRICARE for Life people are typically set with Medicare. It acts as a secondary with drug coverage.
We had quite a few questions about the drug plans. One was, once you have a drug plan, can you switch it year after year?
Yes. So that's what I'm about to do for all of my clients is I do drug plan reviews every year. And I analyze the cost. I utilize the Medicare.gov. Medicare.gov has a wonderful drug analysis tool. I can do it in my sleep where you list your list of drugs, and all of the contracted plans through each state have to put their formularies and everything in there. So when you enter in your drugs, it will spit out the lowest drug cost and premium for your mix of drugs. And so it is overwhelming information to try to translate it sometimes for people. That's what I'm there for. But yes, you can change your drug plan year to year, especially if you get more drugs during the year, because drug plans run from January through December. So if I make a change during the annual enrollment period, that change doesn't take effect until January 1.
Okay.
So yes, you can change your drug plans each year.
Okay. With regard to the Advantage plans, this participant said they heard this plan is not good and they can and may not renew you if you have certain medical conditions or illnesses that pop up. So is that a rumor or is there some truth to that?
That is not true. Advantage plans have to abide by Medicare guidelines. Medicare is behind the scenes. They want these Advantage plans to exist because it's taking the pressure off of Medicare, because we all heard they're losing money. That's what we hear all the time. So these carriers they help manage Medicare's costs, but Medicare is setting the guidelines for them. They are never to ask a health question. They just opened the door, I believe last year, to stage 4 renal disease. So you could have stage 4 kidney failure and get an Advantage plan.
Okay.
They'll cover it. So
follow-up question to that, Nicole. Once you're on an Advantage plan, can you switch to a Medigap plan, or do you have to stay in that lane? I'm thinking of the 2 highways.
That depends. That's where we get into the rules. So let me try to quickly explain. If you choose an Advantage plan first, and you later want to choose the Medigap, you're going to have to answer health questions. Okay. If you choose the Medigap first and later you want to choose the Advantage plan, no health questions. If you choose the Advantage plan and want to switch to an Advantage plan, no health questions. So there are only a few times, and it's with that Medigap that there's health questions that come into play.
Okay.
So there's rules back and forth. You have to be healthy, and even to switch supplements. Like, let's say your premium gets high, you like the coverage that it provides, but you want a lower premium. Well, I can get a lower premium for people, maybe with a different company or within the same company, but they have to pass health questions.
So there were many questions about signing up while still working. This particular individual said, we have always heard that employees should sign up for Part A, even if working still. So can you comment on that?
Yes. So I do. I call that kind of getting your foot in the door, but it's not mandatory. There is no law, there is no guideline that says you have to do that. So when someone asks me if they should, we talk about their work situation. Are you contributing to an HSA? If someone depends on the contribution to the HSA, I'm going to tell them point blank, do not sign up for any part of Medicare because we want to avoid a tax penalty. So we get a timeline of retirement in place, and we strategically plan when they're going to stop contributing to the HSA and then apply for Medicare. Because really, typically, once you're past 65, you can sign up for Part A anytime. Okay, so there is no guideline or law or rule that says you have to do it. Now, some people that are not contributing to their HSA, I'll have them sign up for Part A. We kind of get familiar with the process. We do that Social Security online, and so our foot's in the door. So then we add Part B later when they retire. So it depends on the employee situation.
Okay. So we talked a lot today about people transitioning from a workplace group plan to Medicare, but we had a question about Medicare coverage for people who never worked. So they said, will my spouse be covered if she never worked and she's under 65 when I retire? How would that work?
So if they go on Medicare when they're 65 and the spouse is left without anything, there are other options. And I do all health insurance. So there's other options for the spouse to choose. However, as far as healthcare coverage, but because she's never worked or he's never worked, then they don't have their taxes paid into Medicare. They may not qualify. And that's why everybody needs a Social Security online account. You can see if you qualify or not. It's possible that if the spouse has credits and qualifies for Medicare, that the non-working spouse can qualify under the working spouse.
Okay.
In that case, to sign up, that non-working spouse will not be able to apply online. They will have to call or go to Social Security office.
Okay.
To do that.
All right, I think I'm going to squeeze in one more question here.
Okay.
And thank you for a few extra minutes with us, Nicole. You mentioned the importance of substantiating your coverage if you delay Medicare, right? Is having coverage while you're self-employed, does that qualify in the government's eyes? And can you speak to that a little bit?
I can. So if you are self-employed, what they say, what Medicare says, that's who they is, Medicare, is that you're going to have to make Medicare your primary. So all my business owners that come to me, and that it's just them, like I'm a business owner, I'm going to have to make Medicare my primary insurance. Okay. If I do have like a really tiny group health plan, it becomes my secondary because I'm under 20 employees. So these rules are all stated in Medicare.gov. And I'll warn anybody looking at that site, it is a wealth of information. It says a lot of the same things, and you have to know exactly what to search on there. But if anybody's brave enough, you can find the answer.
Okay. On there. And I'd love to circle back, Nicole, with you just stating again that how people can meet with you and how a consultation with you is of no charge to them.
Yes.
Correct?
So, yes, I answer questions daily. I do not charge to answer questions. I don't charge for a consultation. You've got to have that person in this journey that you trust and that understands your healthcare needs. My biggest thing is your healthcare needs. After being there with families and in catastrophic events, it's super important to protect your retirement income. So you can reach out to my office number, and my website is a great way. Morgan Medicare Solutions.com. My calendar's on there, my number's on there, my presentation is on there. You can go under new to Medicare and the presentation is on there. So
very good.
Yeah.
Well, you have done us a great service today by providing such a thorough and easy to understand overview of such a complex topic. We had record numbers of people sign up for this session, and no doubt it will be reviewed in replay as well. So thank you. And thanks to all of you for spending a little over an hour with us today. We hope that you learned a lot and got a good primer on Medicare. We look forward to seeing you on our final education session for 2023. That'll be coming up on November 14th. So please stay tuned for invitations regarding building a financial foundation. And as always at SRP, we welcome your questions about finances in general, not only saving for retirement, but making sure your today and your tomorrow is as secure as possible. So thanks again, everyone. Enjoy the rest of your day and stay tuned for the replay, which will be sent out later this week.